Very good evening, everyone. Please confirm if you all can hear me. Please let me know in the chat if my voice is loud and clear. So very good evening, everyone. A very warm welcome to all of you joining us today for this insightful and career-focused webinar on from biology graduates to healthcare professionals, careers in medical coding. I'm Dr. Tanushree, and I will be your host for today's session. This webinar is specially designed for life sciences, pharmacy, and allied health graduates who are curious about building a successful and in-demand career in medical coding, an exciting intersection of biology, healthcare, and data. Today's session aims to provide clarity on what medical coding is and why it matters, how your biology background makes you a strong candidate, and what career pathways exist in this field, and most importantly, how you can start, grow, and get placed in this field. So let's dive into the learning and meet our expert speakers. We are pleased to welcome our first speaker, Mr. Saichandu, Assistant Manager, CorroHealth, with over 6 years of specialized experience in inpatient DRG medical coding. He brings deep expertise in coding and categorizing complex hospital records while ensuring strict compliance with regulatory standards. Having successfully transitioned into a leadership role, he now mentors and guides coding teams with precision and clarity. Known for his analytical mindset and attention to detail, Mr. Saichandu consistently upholds accuracy and excellence in every aspect of his work. Mr. Saichandu provides insights on foundations of medical coding, the day-to-day life of a coder, and the current job market. So in his session, Mr. Saichandu, so he will be taking first session and he will be providing insights on from foundations to life of a medical coder and the current job market, especially for life science graduates like many of you. We warmly welcome you, sir, and look forward to gaining from your rich experience and insights. For our second session, we welcome you, sir.
Yeah, thank you, Tanushree. So,
Thank you,
good
sir.
evening, everyone. So, can you all hear me clearly?
Yes, sir, you are audible. We'll come over to your session in a while. So let's first meet our second speaker also. So for our second session, we'll be joined by Ms. Jaya Preeti. Ms. Jaya Preeti is a certified medical coding trainer with over 6 years of experience in healthcare domain. She specializes in teaching CPT, ICD 10 and HCPC level 2 coding systems, backed by a solid foundation in anatomy, physiology, and medical terminology. Her core areas of expertise include evaluation and management coding, surgical coding, anesthesia, and compliance guidelines. As a CPC certified trainer, she has mentored students to successfully pass their CPC exams and start fulfilling careers in medical coding. Her training methodology focuses on real-world coding scenarios, exam strategies, and audit preparation, hands-on case studies, and mock assessments. Currently, Ms. Jayapreeti serves as an academic support specialist in medical coding at Biotecnika, where she continues to share her expertise and passion for the field. Ms. Jayapreeti in her session will guide us through the career pathways, certification options, and skills needed to build a stable and rewarding career in this domain. We welcome you, ma'am.
Thank you. Tanu.
Kindly note everyone, after session 2, we will have a brief Q&A round. So please feel free to drop your questions in the chat box at any time during the webinar. We will address them during the live Q&A session after all the speakers' presentation. So let's begin with session 1. Over to you, Saichandu, sir.
So, good evening, everyone. So, can you all hear me clearly? So, once again.
Yes, sir, you are audible.
Yeah, thank you. So, let me share my screen. Is my screen visible to everyone?
Not yet, sir.
Yeah, just a moment. Now,
Yes, sir. It need to be in a presentation mode, sir.
yes. Okay.
Yeah.
I think now
Thank you,
it's
sir. It's
fine.
perfect.
Yeah. Okay. So I'm excited to here today to talk you about medical coding and more importantly why it is an excellent career path for you. But before we dive into that, let me introduce myself first. So my name is Saichandu and I hold a BSc in life sciences. I have been in medical coding field for over 6 years. So I have begun my coding journey in 2019 as a medical coder trainee. Over the years, I have grown within the industry, progressing to medical coding auditor, then team leader, supervisor, and currently I'm working as assistant manager. So during this time, I also had an opportunity to work in the Philippines for 7 months as a coding team leader. Okay, as you can see, medical coding offers a tremendous growth opportunity and quite fast too. So if you are skilled and dedicated, right? So coming to our first slide, medical coding. So a great career opportunity for life science graduates. So that's the reason we are here, right? So going to our next slide. So our agenda is to discuss why is medical coding and what is medical coding and what does medical coder do, as well as the benefit of doing medical coding and also the benefit of choosing medical coding as a career opportunity and how to become a medical coder. Okay, so first we'll see why is medical coding, right? Medical coding is a healthcare revenue cycle management. So medical coding is a part of healthcare revenue cycle management. So let's start with the broader picture, right? RCM is the process that helps to manage the financial aspects of patient care. Okay, it begins scheduling patient appointment to final payment of bills. Okay, this process helps patients to claim their insurance as well as physicians to get their payment as well as the insurance companies to claim the settlements, right? And this process is crucial and is followed in most of the developed countries such as USA, Australia, Canada, New Zealand, Dubai, and others. The interesting part is that the larger portion of the work is outsourced to countries like ours, okay, which is we are here as a medical coder come in. See, if we see USA, healthcare is more expensive, and more than 95% people will have health insurance. So that's why healthcare RCM, like revenue cycle management, is important here. So as it helps patient to get the payment as well as to claim the insurance as well as physicians to get the payment and insurance companies to settle the uh, like claims of the patients. And here, everything is maintained in electronic health record. So we can see the benefits of revenue cycle management. And so as we discussed that medical coding is just a part of revenue cycle management. And there are a lot more things here. It begins from patient registration, thereafter medical coding, client submission, and processing, thereafter account receivables, payment posting, and denial management. So the only thing here we need to know about is medical coding. Okay, it helps in enhanced cash flow, operational efficiency, and regulatory compliance. So improved patient satisfaction. Right, the healthcare team communicates using accounting system and electronic health records. So because of this electronic health record, as it is a centralized process, this streamline improves the turnaround time, saves providers time and money, right? And as everything in the RCM recorded digitally through the electronic health record, making it streamlined and as well as efficient. Okay, and we can see the active approach to finding and addressing the potential compliance issues. So here compliance issues are related to healthcare guidelines as well as avoiding fraudulence, protecting patient health information. So as all this will come under compliance issues, right? So in this slide we have seen why is medical coding. So we'll just go to the next slide. So what does a medical coder do, right? So basically the medical coding is a translation of physician documentation into standard medical codes. So as we have seen, so everything related to healthcare is documented in EHR, electronic health record. So let's take a case, for example, a male a male of 69-year-old sustained a mechanical fall in home. Okay, and he was admitted to the hospital with severe leg pain. And upon a diagnosis and workup, he was found to have a femur bone fracture, so which is a thigh bone, right? So here to treat that, physician performed a surgery, or if okay, open reduction, internal fixation. So as a medical coder, we have to review entire documentation and analyze the physician documentation, and we have to assign a course for diagnosis as well as procedures, right? So here we can see like reviews. So patient records and assign codes based on the diagnosis as well as procedures. Okay, as a medical coder, we have to review the documentation thoroughly and have to assign codes based on the physician documentations, right? And inputs. So whatever the documentation we have read, and we have to assign it as a codes. So coded information into database and audits documents for accuracy. And acts so as a liaison between healthcare providers and billing officers. So here liaison nothing but a alliance between insurance companies as well as provider. So as a medical coder, we help insurance companies to settle the claim, right? So we'll act as an alliance, between the physician as well as the insurance companies, and ensures confidentiality of patient record. So ensure confidentiality of patient records is a key thing. So we have to protect patient health information, okay, as well as stays updated on coding guidelines and regulations. So we'll be having a updating updates on our coding guidelines regularly per year. As a coder, we have to be updated with coding guidelines regularly and how to assign appropriate diagnosis based on the physician documentation. Am I clear? Okay, so let me go to the next thing. So we have seen why is medical coding required as well as what does medical coder do, and so we'll see the benefits and scope. Okay, so if we see the benefit of medical coding, insurance reimbursement. So the main thing here, the purpose of medical coding is insurance reimbursement. So based on our codes that will be sent to the insurance company to get the payment. So the key thing is insurance benefit as well as healthcare statistics and public health. So based on the codes we have assigned, so it is easy to analyze the healthcare statistics. And so healthcare and hospital and clinic revenue cycle management, and it will also helps to clinical and legal documentation and to maintain hospital policy and planning based on the statistics. So what are the benefits for medical coder, right? Okay, it's a high demand and job security. So the medical coders have a huge demand. So like the RCM industries are looking for the skilled medical coders. Okay, and also the job security. So healthcare is a basic even in a time of recession. No, even there is when there is a down in economical wise, so there will be no recession for medical coders. Okay, as medical coding as a healthcare is an essential sector, right? And it is a skilled based career. So if we increase our skill, so we have a lot more growth opportunities. Okay, so we can join as a medical coder. So based on our skill and dedication, we can go as a medical auditor, trainer, and like team leader. So the growth will be like very fast and rapid. Okay, and good earning potential. So through the medical coding, we can also have a good earning potential. So based on our experience as well as our uh, like designation, we'll be having a chance to earn more. And also the earning will depends on the company, based on the location, as well as the coding we are doing, right? And career growth opportunities, so we already discussed that. So if we are very skilled and as well as dedicated, we have a lot more growth opportunities here, as well as international career options, right? So here, like all the work of medical coding is being outsourced from USA, Dubai, as well as Australia. So there is a chance for international career options as well. So sometimes even like the companies we are working here will offer us to go in abroads. Okay, and we have seen the benefits as well as scope of medical coding. So going to our next slide. So this is the final thing. So how to become a medical coder. So we have seen why is medical coding, and like what is medical coding and what is the benefit of choosing a medical coding as career opportunity. And we also seen like benefits. And here we can see how to become a medical coder. Okay, so learning coding basics. So here, everything we are reviewing the patient documentation, right? So there, the physician will detail the documents about the patient diagnosis, as well as if physician performs any procedures, he will detailedly explain the procedures in documentation. So as a medical coder, we have to review the documentation entirely and how to analyze it appropriately, as well as we have to assign appropriate codes. Okay, so to understand the physician documentation, so we should know medical terminology, right? As well as anatomy and pathophysiology. So pathophysiology, it means we should know the diagnosis as well as the treatment. For example, if we take pneumonia, which is a lower respiratory tract infection, so we should know like what are the symptoms, signs and symptoms of pneumonia. Like the pneumonia will show shortness of breath, cough, and when it comes to treatment, so it should be treated with IV antibiotics. So all should we have to know. So by learning medical terminology and the anatomy and pathophysiology, we'll be expertise in knowing this. And when it comes to diagnosis and procedure coding system, so since we have to assign uh, codes, standard codes for diagnosis as well as procedures. So for diagnosis, we have a coding system that is ICD-10 CM. It is International Classification of Disease 10th clinical modification. Okay, so and when it comes to procedure coding system, so there is a CPT, that is current procedure terminology, as well as PCS. So PCS is procedural coding system, right? And so here you can get it out like the CPT is also about coding the procedures, as well as PCS is also coding the procedures. But CPT is followed by outpatient settings, and PCS is followed in inpatient settings. So again, in healthcare, there are so many things like emergency department, as well as outpatient, same day surgery, as well as inpatient, right? So this CPT is followed in emergency care as well as same day surgery. So when it comes to PCS coding, it is also about the procedure coding system, but it is followed in inpatients, right? And when it comes to certification, so like we should also have a certification. It's an optional, but it is highly recommended. Okay, uh, to get hired very soon. Like we have two certifications, that is CPC as well as CCS. So CPC is a certified professional coder. So that is by AAPC, as well as we have CCS, that is certified coding specialist, and this is offered by AHIMA. Okay, so these are the certification bodies. So here we can see the website URL link over on the slide, right? Sorry. Okay, so official coding, we'll just see how coding works. So here we can see official guidelines for coding. So the Centers for Medicare and Medicaid Services, as well as National Center for Healthcare Statistics (NCHS), these are the two departments within the U.S. federal government of Health and Human Services. So these will provides the guidelines for coding. Okay, so and these codes will be based on international classification of diseases that uses the diseases published by World Health Organization. Okay, again these guidelines will be approved by four organizations. So that is cooperating bodies, the AHA, that is American Hospital Association, as well as American Health Information Management, that is AHIMA, as well as CMS and NCHS. So CMS is the same, like Center for Medicare and Medicaid Services, and uh, NCHS, the National Center for Healthcare Health Statistics, right? So uh, getting certified is an added advantage. So we'll go to the our last slide. Yeah, so we are finished. Okay, so we have seen like why is medical coding, and what is the purpose of medical coding, and what is the benefit of choosing a medical coding as a career, opportunity, and finally how to become a medical coder. Okay,
Thank you
so
so
let
much,
me know.
sir, for thank you so much, sir, for the practical and informative presentation. Um, we'll take up the questions after session two. Uh, just a gentle reminder to everybody, please post your questions in the chat, whether it's about job scope or certification or salary or the training program. Don't hesitate. Please post your queries in the chat. We have esteemed experts with us, and they will be answering your questions during the live Q&A session. So now let's begin with session two. I would like to invite Jayapriti ma'am. So over to you, ma'am.
Hi all, I hope you can see my screen.
Yes, ma'am, it's visible.
Thank you, thank you. Hi, welcome everyone. Thank you for taking the time to attend today's sessions on career pathway and medical coding. My name is Jayapriti, and I'm really excited to share insights on how medical coding plays a vital role in healthcare and how you can build a career in this field. Whether you're completely new to this field or simply exploring a career change, this session is designed to help you to understand what medical coding is and why it is important and how can you build a successful career in it. So in today's session, we will cover what medical coding is and why it is matter, the different type of coding system used, career roles and pathways you can explore, the skills and certification needed, and how to start and grow your career in medical coding. Let's dive into the session. First, learn what is medical coding. So, introduction of medical coding. Medical coding is a process of translating medical information such as diagnosis, procedures, treatments, treatments and equipments into standardized code. These codes are used by insurance company to process claims, by hospital to track services, and even by government to monitor health trends. Without coding, the entire billing and record keeping system in healthcare would break down. So here a simple analogy. Think of medical coding like a translating language. A doctor may describe a patient condition using clinical terms. A coder takes the information and translate into a universally understand format using code sets such as ICD, CPT, and HIPIX. Now let's learn about the purpose and impact of medical coding. Medical coding allows standardized communications between the healthcare providers and insurance. It enables uniform documentation of health conditions and procedures, proper claim submissions and insurance reimbursement, monitoring of public health trends via analysis. The growing demands, the medical coding profession is growing rapidly driven by expansion of global healthcare system, digital transformation and use of EHR. And now let's learn about understanding of medical coding system. Let's explore the three main code system you'll work with as a medical coder. They are ICD, CPT, CPT, HIPIX. So ICD are International Classification of Disease. These code presents patient's diagnosis. They used globally to ensure that diagnosis and conditions are reported in a standardized way. For example, E11.9 means type 2 diabetes without complication. And now let's learn about CPT codes. CPT are current procedural terminology. These codes describe procedure and services provided by healthcare profession like surgeries, lab tests, therapy sessions. Let's have a look on HIPIX code. HIPIX code are Healthcare Common Procedural Coding System. These code cover things not included in the CPTs such as durable medical equipments, prosthesis, ambulance ride, and some drugs. Coder must choose the right code based on the precise documentation. It is not just like copy pasting. You need to analyze clinical notes and determine the most accurate code based on coding guidelines and payer requirement. Accuracy and compliances. Coder plays a vital role in ensuring patients' record correctly reflect services for proper billing and regulatory compliances. Let's know about the qualification needed for medical coding. Um, they are life science graduates, health science medical professional eligible in this field. They are for life sciences like BSc in biology, zoology, botany, biotechnology, biochemistry, BSc nursing, B Pharm, BPT, MBBS, BDS. These all graduates are eligible for into this field, medical coding field. So if you have any one of this qualification, you can learn medical coding very easily and you can dive into this field. And now let's have a look on the certification. The popular certifications are CPC, CCS, CCA. CPC is offered by AAPC, American Academy of Professional Coders. AAPC also offers COC, CIC, CPB, CPME, but the most popular known certification are CPC. Hahimo also offers CCA, that is Certified Coding Associate, and also they offer CCS, CCSP. Mostly training section will go around like 3 to 6 months. You can take it in online or offline mode. So let's know about the essential skills for success in medical coding field. So they are attention to detail, medical knowledge, analytical thinking, technical proficiency, and regulatory knowledge, regulatory understanding. So, in attention to detail, ensuring accuracy in translating complex medical information into precise code, because a single error in a code could result in thousands of dollars in billing discrepancy or claim denials. And understanding medical terminology, you need to understand the terms like laparoscopy, colectomy, angiopectoris. So, understanding anatomy, physiology, terminology, medical terminology to interpret clinical documentation and use it effectively. Analytical thinking. So you'll often be reading between the lines like clinical documentation, deciding which code to apply based on the rules, not assumptions. So software proficiency, technical proficiency, coders work daily with HIACHA system like Epic, coding softwares like 3M and Corner and all. Regulatory knowledge, under, knowledge of insurance policy, healthcare laws, and coding guidelines. So next, we'll move on to how to start getting started in the medical coding. First, you have to complete your education, like enroll in relevant training or degree programs to build a foundation knowledge. Like look for AAPC, HAHIMA approval courses, including medical terminology, coding guidelines, anatomy, and hands-on practices. And then earn certification. Choose a certification based on your interest, like CPC, CCA, and all. And then gain experience, like apply for internship, remote project, or entry-level roles. And then build your resume, strong resume, like highlight your certification, coding accuracy, and the tools you're used, and any project work you have done. And then networking, join organization like AAPC, HAHIMA, attend the webinars monthly, engage in online forms, and then connect with other. LinkedIn. Now let's see the career pathway. So these are the career pathway where you can success in medical coding. They are entry level, mid level, advanced level, and master level. For the entry level, they are like medical coders, junior coders, trainee coders are all in entry level. You'll start with the basic claims, simple cases, and gain experience like interpreting records. And the next, once you gain the experience, you'll be moving into mid levels, like you will be promoted to coding specialist, complaints auditors, or coding auditors, where you will handle more complex record hospital cases, and you will be reviewing codes done by the others to ensure legal and pay complaints. And advanced levels like coding managers, supervisor, regional manager, or RCM manager, where you manage a team of coders, set productivity standards, and monitor documentation's quality. And moving on to from advanced to master level, they are like coding director, operational directors. Now let's have a job lookup and the salary. For the entry level, the demand of certified coders is growing, and especially with the increase in the telehealth and electronic records and healthcare data analytics. Entry level for coders typically earn like 25 to 30. A certified coder will earn. On mid level profession with certification experience can earn up to 60 to 70,000 per month. An advanced role or specialized coder may earn 80,000 and more, especially if managing a team or working with the federal programs. Remote opportunities are expanding. Many coders today work from home with flexible hours and secure time. And other trends, like over 30% of roles now offer a remote and hybrid options. So in every field, medical coding here also we face challenges, and let's see what are the challenges we are facing here. So the demand of certified coders is high. The challenges are keeping up with continual codes and updates and regulations, maintaining accuracy and then time constraint. Constant changes like coders and payers rules changes every year, so you need to be stay updated. So that are the challenges we're facing on this field, and pressure to meet productivity can be demanding and repetitive now. Some tasks can feel routine, especially high volume settings. Complex cases, sometimes doctor notes are vague and you have to so deep research on it. But this field also rewards that you stay updated. So commit to ongoing education, successful tip I'm telling, and recertification, join professional organizations like AAPC, HAHIMA, practice coding regularly and seek constructive feedback, utilize technology to improve efficiency. So moving on to conclusion, like the key takeaways to sum up, medical coding is a flexible, growing, and rewarding career. Whether you want a stable job or remote work or advancement opportunity, coding can be a great fit. It lets you work remotely, specialize and grow in leadership roles, be a part of industries that truly matters. So I think your next step will be start with an education, earn certification, gain real experience, and keep learning and networking and dive into coding. So thank you for your time and attention today. It's been a pleasure sharing the session with you. I hope it has sparked interest and confidence as a consider and continue our education in medical coding. As Steve Jobs says, the only way to do great work is to love what you do. Let this God be your guide as you explore the possibilities in the fulfilling career. Thank you. Thank you once again for joining the session. Thank you so much.
Thank you so much, ma'am, for such a insightful session. And definitely, it's really very helpful for our attendees who wants to make a career in this field. So I can see many questions in the chat. So again, a reminder, if you have any question, please post your queries in the chat. Now we will take up your queries. So let's begin with the Q&A session. Let's now open the floor for your questions. So first question I will take of Ahili Singha Chaudhary. So Ahili wants to know that as a life science graduate and a fresher, do I have to do allied courses to be eligible to enter this field? Mr. Saichan, sir, would you like to answer this question? Sir, can you hear me?
Yeah, yes. You can like have a training in medical coding from any of the institute. Okay, so there are so many institutes that will offer training for medical coding. Okay, so by learning medical coding, then you can go for the certification.
And also on life sciences, to add on Saichan, you'll be knowing like terminology, anatomy, physiology will be well known, but we have to know about CPD, ICD, and all. So it is must to learn it on the institution. And if you dive into the companies, like it would be easy for you to grab easily.
Yes, absolutely.
So I hope this answers your question, Ahili. Uh, Next question is of Prarthana Kamble. So Prarthana has two questions. So first question I'm taking is that whether BSc Biotechnology graduate will be eligible to get into this field of medical coding. Jayapriti ma'am, would you like to answer this question?
Can you repeat? Sorry.
That whether BSc Biotechnology graduates will be eligible to get into the field of medical coding.
Yes, yes. Most welcome. All science graduate can work in medical coding. They can easily grab it.
Okay.
Biotechnology, biochemistry, botany, zoology, biology are all eligible for doing medical.
Thank you, ma'am. I hope this answers your question, Prarthana. We have a very interesting question from Kiran Nanabe. So Kiran wants to know that if AI, like now we are living in an era of artificial intelligence, so whether medical coding jobs will vanish soon with artificial intelligence coming. Sir, would you like to take up this question?
Yes, it's an interesting question. Obviously, even experienced coders will have the same question. So definitely not. So artificial intelligence, can't replace the medical coders. So today, medical coding, human intelligence is required. So maybe it may make the medical coding smooth. So by introducing AI software into the system.
Thank you, sir. I hope this answers your question, Kiran. And there is a question from Rakshita that what is the difference between bioinformatics and medical coding?
Okay,
Any?
medical coding is deal with like procedure code is converted to numerical code, a standardized code. For example, if doctor perform knee arthroplasty, what medical coder do is they will transform into a medical code like 27447. It represent, it describes like total knee arthroplasty. And I've told you about this is CPT code, and I've told you about ICD. So if the patient is diagnosed as like osteoarthritis, so for the knee osteoarthritis, the ICD will be M17.11 or 12 on the laterality. So this is how coding will work. Medical coding will work.
Thank you so much, ma'am. I hope this answers your question. Rakshita, we have a question from Meghna. I think it is, ma'am, you have already answered, but still, if you can provide some insight on this, that whether medical coding is useful for MSc biotechnology student. So, ma'am, like in detail, like if you can throw some insight on this.
Yes, all masters, I've already told you, life science graduate are most welcome in the coding field. Actually, while recruiting, they'll be seeking for life science graduate only. Either bachelor, masters, like life science graduate are eligible in medical coding.
Thank you, ma'am. I hope this answers your question. Please feel free to post your queries. You will not get a chance, such chance where we have a live experts with us. So get your queries answered during this live Q&A session. I request everyone, those who are attending and watching this webinar, please post your queries. Don't hesitate. If you have a question related to career, if you have a question related to certification, if you have a question like how to start, how to enter into this field, please feel free to ask. Maybe you are helping others also by asking such questions, because others might also have the similar question, but they hesitate to ask. So I request everyone, please don't hesitate and post your questions. We still have time. We have a question from Shweta Shri, that what are the roles for freshers in medical coding? Sir, would you like to answer this question? Saichandu, sir?
Yeah, definitely. So what other roles? If it is for life science graduates, it's obviously a medical coding. Okay, so if you're from different background, maybe non-life science graduate, so maybe you will be having a chance in AR calling. So if you're life science graduate, uh, the only chance in RCM industry is medical coding. Okay, so eventually based on your experience and skill, so you can go as a quality analyst, so you can grow into the leadership as well.
Thank you so much, sir. I hope this answers the question, Shweta. We have a question from Anjali, that what should we opt for? BTech in biotech or BSc in biotech to get a good scope in this medical coding field in future for a good pay scale? So I think during the graduation level, many students have this doubt that whether they should go for BTech biotech or BSc biotech. So for medical coding field, what you suggest, sir and ma'am, that which field will be better?
So yeah, I'll take this question. So instead of if you are like choosing your graduation, if you are a life science, if you have completed your intermediate in the by PC, so I suggest you to choose like professional degree. So maybe it's a B pharmacy, BPT, as well as 4 years nursing. So it is more preferable for medical coding, because in graduation level itself you will be having deep knowledge in anatomy, pathophysiology, so everything. So if you choose B Pharm and BPT as well as nursing, it will be more helpful for medical coding, and you will be the more preferred one as well.
Thank you so much, sir. I hope this answers your question, Anjali. We have a question from Rohita. How much can I earn as a medical coder? Jayapriti ma'am, would you like to take up this question?
Yes, as a certified medical coder on entry level, you'll be earning like 25 to 30. If you're non-certified, you'll be earning like around 20. Will be your take home monthly pay will be 20 if you're non-certified coder. If you're certified coder, it will go around like 25 to 30. Once you gain experience, you will have incentives here in this field, so you can earn more. On once your experience like 70,000 per annum, you can earn it.
Okay, I hope this answers your question, Rohita. We have a question from Humagni De. So Humagni wants to know that how to transition to a medical coding from a biochemistry, MSc in biochemistry. So, sir and ma'am, anybody would like to take up this question?
Yeah, sure. I'll take this question. So I hope this question was already answered. So if you want to grow in your medical coding, the first thing we have to learn medical coding as well as anatomy and pathophysiology. Okay, so once if you learn about medical coding as well as anatomy and pathophysiology, and getting a certification is an added advantage. So once you're done with that, so you can easily you'll easily get placed in medical coding.
I hope this answers your question, Humagni. We have a question from Disha Chalani that she wants to know about, like, she wants to have a brief summary on medical writing and difference between medical coding and medical writing. So, like, which of them have more scope in future, medical coding or medical writing? Jayapriti ma'am, would you like to take up this question?
Okay, and I'll go with medical coding because I'm into this field and I know how it is globally drastically developing. So I'll go into the medical coding because in healthcare, all our aged people. We are they are our system and their system is totally different. They are all into insurance company. So Saichandu told you about RCM, so their methodology is totally different. So medical coding, I would suggest always medical coding will be have a good future in coming days.
Thank you so much, ma'am, for answering this question. There is a question from Dhruv, and I'm sure many of them must be having the similar question. Especially nowadays, many people prefer to have a work from home job, right? So, is it possible that in medical coding, work from home is possible? And, like, to be precise, Dhruv has asked that after getting certified and person wants training, work from home, then which company one can apply?
Okay, I'll take up this question. There are many companies who's recruiting work from home actually. So during COVID, I worked as a coder. So we all worked in work from home only. So many like 30% in this field are working in work from home, and many companies like experts companies also recruiting for work from home. So it is not a big deal. They are work from home options too.
I hope this answers your question, Dhruv. We have a question from Vaishnavi Yadav that what are the future opportunities of medical coder?
Okay, in my slides, I've shown you like career growth, like entry level, mid level, advanced master level. The master level role you'll be promoting like director tools from trainee coder, auditor, supervisor, trainer, manager, assistant manager, manager, and then promoting to director. So future opportunities in medical code.
Saichan sir, would you like to add something?
Yeah. So there are many layers in between. So medical coding is one of the starting stage. So you can eventually grow to the coding auditor as well as trainer, team leader, and the manager level. So you can go up to the VP level as well. Okay, it's medical coding. In medical coding field there are so many layers.
So I hope this answers your question, Vaishnavi. Thank you so much, sir, for the very detailed answer. Then I think there are some of the attendees who have the confusion between the computational biology and medical coding. So, like Anjali has a question, Anjali V, that what do computational biologists do? Like she has a confusion that is it something related to medical coding or it is completely different?
Let me take this question. So it's completely different. So computational biologist is completely different from medical coding. So like the role of the medical coder is to review the physician documentation and convert the documentation into like standard codes. So it completely differs from computational biologist.
Thank you so much, sir. I hope this answers the question, Anjali. Uh, Everyone, please post your queries. I will be taking up 2 and 3 queries to the max now because we are approaching to the end uh, of this webinar. So, one question I will be taking of Guna, that is it necessary to have a coding training to get into companies, because she has an understanding of Guna has an understanding of physiology and anatomy. As mentioned that as a life science graduate, going to have an understanding in physiology and anatomy. So it is necessary to have a coding training to get into companies. So I think he's mainly like Guna is mainly talking about the companies who hire medical coders. Sir and ma'am, anybody would like to take up this question?
Yeah, let me take this question. And yeah, obviously training is required. Yes, there are a few companies even they will directly hire the life science graduate freshers as well, but it is highly recommended to have a training before. So that will help you to get placed very quickly. And also I want to give a detailed information of the before question, that is about the difference between computational biologist as well as medical coding. So medical coding is basically a supporting like it's a supporting role. So we are supporting physicians and we are giving them code. When it comes to computational biology, so it's completely a research oriented. So there is a like that is the difference, that a biologist is a research oriented and this is completely different.
To
Thank you
add
so
on
much.
some said, like
Sure.
what we do is we are, as he told, we are doing supporting, like we are being like a bridge between the payers and the providers. If provider will do a procedure and payer will give money, in this between we are helping them, like we are supporting, like transforming the procedure code into a numerical code. By the way, the insurance company take this code and they'll pay to the provider. So we are acting like a bridge between them. So I hope that helps. Thank you.
Yeah, sure, ma'am. Definitely, it helps. I hope this answers the question, Guna. We have a question from Noman Khan, that why medical coding is important for MBBS graduate.
Okay, let me take up this question. So for MBBS graduate, like MBBS graduate can easily understand the physician documentation. So other life science graduates, when it comes to BSc pharmacy, so like they need some extra training. So MBBS graduate can easily understand the physician documentation just by reading the chief complaint that patient was admitted, and he clearly understand the clinical picture, okay, based on the lab workup as well as radiology workup as well. And like the growth will also be high for MBBS graduates.
And also, the MBBS doctors can understand other doctor handwriting so easily. Sometimes not EHR system record we will have. Sometimes we will have doctor writings notes too. So in that way, the MBBS doctor can easily understand and easily code it. And also, it is 9 to 6 hour shift. So easily we can done our work and wind up and take rest. So in that way, it is easy for them after doing MBBS switching into medical coding.
Thank you so much, ma'am, for answer for such a detailed explanation. Everybody, I can see many questions related to that whether BTech, BSc Biotechnology students can do this or about the salary. So I think some of you might have joined late. So please go through the webinar. The recording will be there on YouTube. You can go through the webinar, and all these points have been already covered in detail by our experts. Okay, so regarding the salary, regarding the eligibility, who all can apply, who all can make a career in this field. Okay, so I request those who have joined late to please go through the recording after the webinar ends. So one last question I will take, and that is of Hindavi Sai Sindhu. That does a diploma in pharmacy can go for medical coding or should pursue B Pharma compulsory? Anybody would like to take up this question, Saran ma'am?
Yeah, yes, I'll take this question. So that this is a difficult to answer. So mostly I'll see. So companies will look for the graduates. So that's always better, like to have a graduation. S-
Ma'am, would you like to add something, Jayapriti ma'am?
Yes, a bachelor degree is, I would recommend for doing bachelor degrees and then taking courses and then into the companies. I would suggest like doing bachelor's, it will be good. Most company will prefer degrees, not
Thank
diploma
you.
course.
Thank you so much, ma'am and sir. I hope this answers your question, Hindavi. So I can see a lot many questions still coming, but dear attendees, due to time constraint, we have to end the Q&A session now. But don't worry, you can always post your questions at cst@biotecnika.org, and our experts will be happy to answer them there. So, as we come to the close of today's insightful webinar, I would like to extend my heartfelt thanks to our esteemed speakers. So, thank you so much, Mr. Saichan sir and Ms. Jayapriti ma'am, for your insightful sessions today. Mr. Saichan sir, your detailed introduction to medical coding, its benefits and scope, and its relevance to life science graduates to truly clarified the scope and impact of this career path, and we truly appreciate your time and expert guidance. Also, Jayapriti ma'am, your practical guidance on career pathways, essential skills, certifications, salary, trends, it provide immense value for our attendees, and we sincerely appreciate the time, effort, and expertise you shared with us. So to all our participants also, I would like to thank you for your active participation and enthusiasm. Definitely, medical coding is a very booming field and important field. It offers a stable job opportunities and a good career growth. But with the right training, tools, and certifications, like right training, tools, and certifications are needed. And with the right tools, training, and certifications, you can definitely transition into this profession successfully. It doesn't matter whether you are BSc Biotech or MSc Biotech or BSc or MSc Biochemistry or Microbiology. Uh, so to help you in this, Biotecnika is coming up with medical coding certificate. We are coming up with a program, medical coding project work and placement program, which is starting from 20th June. And it is just designed to help you to make that transition with expert guidance, real world projects, and placement support. So if you are ready to move from being a biology graduate to a healthcare professional, this is your opportunity. So thank you again, and we wish you the very best in your career journey. Thank you, everyone.